At the Atlantic Health System, we embraced this concept of moving to value several years ago, and we've made it an absolute organizational priority. And what that means is that you really have to change the way you do your work and the way you think about your work in order for this to be effective. Things like integrated care versus the silos that we're in, things like the systems and processes that we have, and most importantly, the talent that we've had to bring into the organization. So our focus is really in two areas. One is, how do we drive as much revenue to risk as possible? And then the second is, we have to focus our efforts on investing in technology that really do two things. One is it creates greater stickiness with our patients/consumers, and then the second is that it lowers the cost of care. We have about 15 different programs that are moving our revenue from fee-for-service into value-based payments. The first are what I call the ACA-enabled initiatives, and that really occurred over 5 years ago. So we've invested a lot and committed a lot to ACOs, or the MSSP program, things like patient-centered medical homes, and we really participate in those programs, and we find those programs, we consider them experiments, to be incredibly helpful. The second area is to think about our own team members and dependents as a full risk pool. And that has created so much opportunity, not just at Atlantic, but we've been able to now collaborate with 6 other health systems. So we've taken our 25,000 covered lives in that plan, and it's now adapted to 75,000. And that has become another place of experiment for us about how do we provide better access, how do we reduce the cost of care, and then how do we expand a network in a way that we can use it for other things. And while that may not sound like innovation, it really is in our field. How do we do things differently? The starting point is the electronic health record, completely wiring all 400 sites of care within our organization and many community practices. That has created a data repository that we could only imagine, and the opportunity to mix claims data with clinical data has been incredibly important in helping make better decisions. The second is standing up areas like data analytics and making those investments. Again, is this innovation? In hospitals and health systems, it really is. We have roles and people in our organization that we'd never had before, and I'm really encouraged by that. Value means different things to different organizations, but at the Atlantic Health System, what it's really all about is quality and access, plus the experience that our patients have as it relates to the overall cost of care. And that cost of care is really focused on what is that individual's responsibility, because that's how people see it. So we are relentless in our pursuit of value as it relates to those things. We have an opportunity today to introduce healthcare leadership to people that maybe never even imagined that. And we have several programs at Atlantic where we do that. But in thinking about that, what's the pitch? In other words, what do you say to somebody that's got the world open to them and can do so many other things? How do you make healthcare a priority? And that's where you need to touch their hearts. Because we have a generation of folks who care about things. They care about climate change. They care about their communities in different ways. So let's tap into that. And I think that we have a unique story to tell. We truly are a business with a purpose.